Please help him.
We are doing everything we can, Chloe. His oxygen is dropping.
Okay? Okay?
He can't breathe. Why can't he breathe?
I need to check his oxygen levels immediately. Try to stay calm. This measures the oxygen in his blood.
What does that mean? Is that bad? Please, just tell me.
We need an X-ray. Right now.
It's pneumonia.
Pneumonia?
Oh, God.
It's serious. His oxygen is low. That is why he's fighting so hard.
In that moment, she didn't just see a patient. She saw me. What do we do? How do we fix this?
I am admitting him. Right now. I will give him strong antibiotics.
Gorgeous, okay, no.
Hello and welcome. Today, we're going to talk about something that can cause a lot of stress for new parents and caregivers, and that's a newborn's breathing. It can be so nerve-wracking when you're just not sure what's normal and what isn't. But you know what? Our goal here is to just break it all down, piece by piece, so you feel informed and really, truly empowered. So, let's just dive right into the biggest question on every caregiver's mind. How do you actually know if your baby is having a hard time breathing? This is the core issue we're going to unpack, giving you some really clear, observable signs to look out for. First things first, let's get a handle on some of the terms you might hear from a doctor or nurse. Understanding the lingo is the first big step in taking the fear out of a scary situation. We're going to make this super simple. Okay, so you might hear this phrase, neonatal pneumonia. It sounds big and serious, and it is, but let's just pull it apart. Neonatal, that simply means the newborn period, those first 28 days. And pneumonia is just a medical word for an infection in the lungs. So that's the clinical definition. But let's forget the jargon for a minute. All this really means is that there's an infection inside a tiny baby's lungs, and that infection makes it way harder for them to get the oxygen their little body needs. See? When you put it like that, it's a lot less intimidating. Now, that lung infection often leads to something called respiratory distress. And this is the part that you can actually see. It's not the infection itself, but it's the sign that the infection is causing a problem. It's that visible effort, seeing your baby working so much harder than normal just to take a breath. This is what you'll be watching for. So the next question that naturally pops into your head is why? Why did this happen? And I know that question can come with a whole lot of guilt or worry, so let's just clear the air. Understanding the cause is really key to understanding your role in the solution. An infection like this can get started in a couple of ways. Sometimes it's from bacteria that were just present during the birth, or it can be picked up from the environment after the baby is born. But here's the most crucial point, and I really want you to hear this. This is a medical complication. It is not something you did wrong. Your job is not to carry blame. Your job is to be an observer and an advocate for your child. And this is just the perfect way to think about it. You're in a partnership. Your expertise is your baby. You know their little noises, their movements, their patterns better than anyone on the planet. The medical team brings the clinical expertise, and together, you form the absolute perfect team to get your baby healthy again. All right, this next part is maybe the most practical and important section of our whole chat. We are going to give you the specific observable signs that tell you it's time to get medical attention. This is your toolkit for observation.
So these are the key signs that are going to empower you to notice changes early. Be on the lookout for breathing that's consistently fast and doesn't slow down even when they're asleep. Listen for a little grunting sound with each and every breath. Watch their nose. Do you see their nostrils flaring out when they breathe in? You might also see the muscles in their chest or around their neck pulling in sharply. And a bluish tint around the skin or lips is a very serious sign. And finally, if they're not feeding well or they just seem unusually tired or listless, it can mean their body is just working way too hard on breathing.
I really cannot stress this enough. This is not a wait-and-see situation. Your instincts are your best guide. If you see any of these signs of distress, the single most important thing you can do is call your doctor or head to the emergency room right away. Acting early is everything.
Okay, so what happens once you get help? A hospital can feel so overwhelming, but the process for treating neonatal pneumonia is actually very structured and logical. So let's just walk through the steps so you know exactly what to expect.
So, the medical response follows this really clear plan. First, they'll confirm the diagnosis. They'll use tools like a stethoscope, maybe a chest x-ray, or some lab tests. Once they know for sure it's a bacterial infection, they will start treatment with antibiotics right away. Then comes what we call supportive care, and this part is so crucial. This just means helping the baby's body while the medicine does its work. It could be a little extra oxygen, IV fluids if they're too tired to eat, and very careful monitoring. All of this just supports your baby's body. And then finally, you get to see that gradual improvement, day by day, until they're breathing and feeding comfortably all on their own.
We have covered a lot, from defining the problem to recognizing the signs and understanding the treatment. So now let's bring it all home and focus on the most important takeaways for you, the caregiver.
If you remember nothing else from today, please remember these points. Trust your gut, that feeling you get when something just seems off. Make a habit of just watching your baby's normal breathing so you'll notice right away when it changes. Act without delay if you see those signs of distress we talked about, and know that you are a vital part of the care team. Your voice and your observations are critical. And finally, hold on to this. With quick, proper medical care, babies recover from this. There is a clear path back to health.
So, I'll leave you with this final thought. We often think of watching over a newborn as a source of anxiety, right? But what if we just reframed it? What if we see that focused, loving observation not as worry, but as a caregiver's true superpower? It's the tool that allows you to be the most effective protector and advocate for your child. Thank you so much for joining me.